Next is the occupational therapist. We call them OT. Their job is to help the patient get back to their everyday activities such as dressing, bathing, cooking, brushing of teeth, making a cup of tea, making a cup of chocolate, even writing. They work on independence, ensuring the patient gain their independence back. You agree with me? We all want to be independent. Yes, that your relative, that person you are looking after does not like to be dependent on. They don't. They want to gain their independence. I will say again, extend grace to them. Yes, stroke can make them to find it difficult to do some of these things. And it's such a fresh breath, believe you me, to see how stroke patients take the baby steps towards each of those activities. OT, they're doing a great job. Shout out to you guys. We also have neuropsychologists. They're also part of the team. What they do is to support the patient's mind, helping with memory, with thinking skills. There are mood changes, emotional challenges that often comes after stroke. Yes, it can be a lot. As they go through grief, they go through depression, patient go through anxiety, and then you just see that, oh, this person was kind of jovial yesterday, and you're speaking to them today, and like they're so down in mood, they don't want to talk. So when we notice some of these things, we make referral to neuropsychologists. And trust me, by the time they are reviewed and some things are put in place, you see them coming out of it. And another thing I'm going to say about this is family support. Those that have family support, I've seen them recover tremendously. Like their recovery seems to be fast because family is everything. So don't leave that person. Don't go away from them. Call them, visit them, help them, speak positively to them. Before you know, it looks like magic. They are recovering very fast. And yes, we have the doctors. Yeah, they play a central role in a stroke patient recovery. Yes, they are the ones. They are the ones that first identify the type of stroke when you present to the hospital. After those signs and symptoms that you pick on time, and they make quick decisions that can save the brain from further damage, which can be surgery or other areas, just to prevent the progression of that stroke. But their work doesn't stop after the emergency attendance to you. They pay attention to your blood pressure, to your sugar levels, to your cholesterol, and your overall stability to prevent another stroke. So all the investigations you do, the blood tests, the scans, MRI, CT, everything that you do is not because they just want to keep collecting your money. No, it allows the doctors to make the accurate decisions for your health, for your loved one's health. So when this result comes out, it enables them to make adjustments to your medications. They're able to track your progress. For instance, a CT was done and they will notice a clot. After the surgical or medical intervention, another scan is repeated. It helps to know, oh, has this clot gone? Is there a new one? So it helps them to track your progress, and it guides the entire rehabilitation team. So everyone is just working towards the same goal to make sure that you recover after stroke. And for the patient and their family, the doctors also help to explain what is happening. They tell you what to expect, and they tell you how to stay safe, how to support your family, how you yourself should stay safe during recovery. So their support makes the healing journey very clear, safe, and more coordinated. Just see them as at the center, coordinating everything. Also, we have the dietitian. We call them dietitian and nutritionists. So they play a big role too. They help in guiding the patient towards healthy eating choices that will help meet the patient nutritional needs, that helps protect the brain, control blood pressure, and support long-term recovery. So you see them making recommendations of the type of food that you can eat that can aid your recovery. So possibly your cholesterol level is high, or advice on that, put their recommendations, and it helps. And also for patients that cannot eat, are having difficulty swallowing, they give recommendations as well. Sometimes we pass an NG2 peg just to make sure that the patient is not losing entirely on the necessary nutrients that the body needs. Because you need food. I always say it, chop first. Whatever you are going through, eat first. Because you need strength, you need your inner strength, you need adequate nutrients to be able to fight whatever it is that you are going through. The dietitians and the nutritionists also help in giving recommendations about this. So shout out to all our dietitians and nutritionists. And we have the nurses. Nurses provide essential medical care to stroke patients during recovery. All the team members have highlighted so far, and I said they make recommendations. Everything comes to nurses, and we ensure that all these are carried out. The OT has made recommendation, assist patient with this in conjunction with the CSWs. We call them clinical support workers or healthcare assistants. So you see us doing that. The PT has recommended that patients should be hoisted. Yeah, they don't just get out of there. We hoist them. Zimmer frame. Zimmer frame usually is like assistance of 1 or 2. Same with Serra Steady. Serra Steady is assistance of 1 or 2. So you see us, we are doing that. The pharmacies, the doctors have made changes to your medications. You've gotten it. Yeah, we dispense that for you. We monitor your blood pressure. We monitor your sugar. When there are changes, we're able to escalate. We're able to take actions as per protocol. We all, as a team, together, we support our patients physically, mentally, and emotionally, because stroke recovery is not just about healing the body, but helping the person return to the life they love. When you come to the hospital, I'm going to add this. I know emotions are high, lots of things are going on. Please extend grace to the health workers looking after your loved ones. Extend grace to the health workers looking after you, because as a team, we're able to pick things on time, do the needful. Thank you very much.